A patchy beard isn't always about age or genetic catching up with you. For a lot of men, the hair was never going to grow there in the first place. Maybe it's a scar, maybe it's uneven density, maybe one cheek fills in and the other doesn't. A beard transplant fixes that permanently using your own hair. In this video, we'll walk you through exactly how it works, how many grafts you need, what the donor area is, and how long the healing takes. Straight answers, no fluff. A beard transplant moves hair follicles from the back of your scalp to your face to fill in patchy, thin, or bald areas of facial hair. It's the same principle as a scalp hair transplant, your own follicles relocated to where you want growth. The follicles taken from the back of the head are genetically resistant to balding, so once they settle into the beard area, they keep growing for life. You shave them, trim them, and style them exactly like natural beard hair, because that's what they become. Beard transplants use DHI with a Choi implanter pen because it gives precise control over the angle and direction of each hair, which matters enormously on the face. Angle is everything in a beard. Scalp hair grows roughly straight out, but beard hair lays flatter and points downward, and the direction shifts across the jaw, chin, and cheeks. The DHI pen lets the surgeon place each follicle at the exact angle needed, so the beard grows in looking natural, not like it was planted in rows. At Vera Clinic, this is done one follicle at a time, which is what separates a natural result from an obvious one. Most beard transplants use between 1,500 and 3,000 grafts, depending on how much area you fill in and the density you want. A full beard build-up needs more. Fill-in small patches or a scar needs far fewer. And as a rough guide, cheeks and full beard density sit at the higher end. A goatee or moustache area needs less, and covering a single scar or gap might only take a few hundred grafts. The surgeon assesses your donor supply and your goals together, because the donor area on your scalp is a finite resource that also has to last you a lifetime. The hair almost always comes from the back and sides of your scalp, the same permanent donor zone used for scalp transplants. In some cases, hair from under the chin or neck can be used. Scalp donor hair is chosen because it's plentiful, permanent, and a close match in a caliber to beard hair. A good surgeon selects the finest hairs from the donor zone for the edges of the beard and the hairline of the cheeks, so the transition looks soft rather than abrupt. No, the procedure itself is done under local anesthesia, so you do not feel the extraction or implantation. The main sensation is the initial numbing injection, and at Vera Clinic, our pen-free anesthesia approach is designed to make even that step comfortable. Afterward, most patients describe mild tightness or tenderness rather than real pain, easily managed with standard pain relief. It's one of the most comfortable procedures, partly because the treated area is small compared to a full scalp hair transplant. The surface heals within about a week. Tiny scabs around each implanted hair fall off in 7 to 10 days. Final beard growth, though, takes longer. The transplanted hair shed within the first few weeks, then regrow and fill in over 6 to 12 months. The shedding phase is normal and expected. It's called shock loss and doesn't mean the transplant failed. The follicles are intact under the skin. They simply reset before pushing out new growth. By around the 6-month mark, you'll see real density and the final result in by 12 months. Yes, because the transplanted follicles come from the balding-resistant donor zone. They keep growing permanently once established. You can shave, trim, and grow them out like natural beard hair. There is no maintenance product required to keep them. The result is a one-time procedure that becomes a permanent part of your face. A beard transplant is one of the most reliable procedures in hair restoration. Small treatment area, high comfort, and permanent natural result when the angles are done right. The last part is where experience matters most. Within more than 13 years and over 40,000 patients, Vera Clinic places each follicle by hand to match the natural flow of your beard. If you're considering it, you can send us photos for an honest assessment of your donor supply and what's realistically achievable. The link is in the description.